Hi, Governor.
Hey.
So it's been 5 days now since Chris Neuwirth was fired from his post as assistant.
Since what, sorry?
Since Chris Neuwirth was fired from his post as assistant commissioner of the Department of Health. Now, this is an official that was important enough to have joined you at several briefings, and who you entrusted to answer questions on your behalf and on the behalf of your administration. Now, over the last 5 days, you've more than once declined to comment or answer questions about why Mr. Neuwirth was fired, citing a policy to not discuss personnel issues. I'm wondering if this was 2017 and we were in the midst of a pandemic and Governor Christie declined to comment on a high-ranking official in a department that was responsible for dealing with the crisis, would you be satisfied? And I also want to ask, if you won't say exactly why Mr. Neuwirth was fired, can you at least say that he was not fired for endangering New Jerseyans' lives?
I hate to disappoint you. We don't comment on personnel matters, and you'll have to ask Governor Christie. Thank you. Please.
Governor, what's your response to the anonymous letter written by DOH employees who allege that your administration's response to COVID-19 was a, quote, unmitigated failure that led to, quote, preventable deaths, and also called for the resignation of Commissioner Persicelli? Thank you.
Yeah, I mean, we don't spend any time in replying to anonymous anythings. So I'm not going to deign that letter with any comment, period, full stop. We spend, all of us, every single minute of every day trying to save as many lives as we can. We've gone, as an example, from nothing on testing, literally nothing, to #1 in the nation. We've gone from nothing in PPE, personal protective equipment, to having put out per capita as much as any other American state. I've said it publicly to her, with her rather, and I've said it privately with her. Judy is not going anywhere, and she's as good as it gets anywhere in the United States. Thank you. Paul, good afternoon.
Oh, hi. On March 27th, the MMWR put out a study showing the threat of spread in nursing homes was extremely rapid. Yet on March 31st, your health department issued an order to nursing homes that they must accept COVID-19 patients. Other states, such as Florida, followed the CDC advice and had much lower death rates. Why did your administration ignore the data and science on that issue that cost so many lives? And those 3 employees also said your data cannot be trusted. Why should we trust that any other decisions are based on solid data? Do you really have data that shows shopping in big box stores is less risky than shopping in small stores? If not, why are the small stores shut?
Paul, as I said, I'll repeat what I said a minute ago. We're not going to respond to a letter from 3 anonymous people. It's just not going to happen. Yeah, I heard your question. I heard your question. That's just, that's inaccurate. It's completely inaccurate. And we've addressed this before already. This is the actions that were taken and the steps that were taken by the health commissioner was not to put COVID positive residents back into a general population. There were very strict guidelines as to how folks should be reintegrated, including, I use the word cohort, and that means separation, in some cases by floor, by building, by wing. It had very strict requests in terms of PPE. It had, this is from Judy and her team, it had very strict parameters about staff. In other words, you can't, it's not just residents, you couldn't cross-fertilize a staff member from one wing to another. It was very, very clear. If people violated that at the operator level, then they need to be held accountable. Do you want to add anything to that?
The CDC guidance, by the way, mirrored what we put out. In fact, the chart that CDC put out, sharing with the LTCs, with the long-term care facilities, how they should cohort, staff, and the use of PPE, was exactly the same as what we put out. So I just want to clear that up.
I also,
secondly,
no.
I'm sorry, go ahead, the governor.
Go.
Secondly,
Judy, let there be no doubt you're the boss here.
March 31st, we put that out. We also told the long-term care facilities, if you cannot do that, you cannot admit, let us know. April 1st, 99 long-term care facilities told us they could not admit. So we immediately started looking for available beds for hospitals to be able to admit their patients. And we located 707. So there were beds for the hospitals. Within a week, over 200 long-term care facilities told us they could not admit. They didn't have the staffing. They didn't have appropriate PPE. They couldn't cohort. Their physical plant capacity did not allow them to cohort. Over 200. And we said, thank you, we will locate beds for our patients.
May I say one thing? I think it's tomorrow, Judy. I think we're going to, the firm that you hired has got their report, and I think we're going to talk to that tomorrow. So tomorrow will be a big long-term care day. I believe it'll be tomorrow, either tomorrow or on Thursday. Have I got that right? Thank you.